When we first did all the research studies, pretty much 40, 50 years ago when it came about heart attacks, they were mainly done in men.
Oh, really?
Yeah.
Oh, I'm so surprised.
So we have these things called typical and atypical symptoms.
Okay.
Typical symptoms are really what's seen in men.
Okay.
And then atypical symptoms are what we think about seen in women. For women, a lot of times, they might actually end up getting things like nausea. They might have some sweating, fatigue, things like that we see a lot more common in women than we do in men.
I love my grandma so much. She was my mom's mom, and I called her Grandma Grapefruit. She always had a grapefruit for breakfast because a diet in the 1950s told her it would help her keep her slender figure. My grandmother also loved a good old-fashioned. Her real name was Florence, and she was super, super fancy. Her closet had so many gold-threaded dresses and furs. I used to love digging through her jewelry box because it was full of fabulous costume jewelry. In fact, I like to think I'm a lot like her because I love a good costume. One night when I was around 6 years old, as we were getting off the phone, I said goodnight and hung up. Moments later, I wanted to call her back because I'd forgotten to tell her I love you, and my mom assured me that I could tell her the next time we talked. But a couple hours later, my mom woke me up to tell me that Grandma Grapefruit had passed away. She had fallen unconscious at a party and never woke up. She'd had a massive heart attack. Turns out bad hearts run in my family. I have always wondered if there had been any warning signs that could have led her to the doctor's office instead of that party. Though I do find solace in the fact that she died doing exactly what she loved the most, being surrounded by family and friends, laughing and having a good time. It's not a bad way to go. I have always heard that a woman's heart attack looks very different than a man's. Why is that? What are the early signs that your heart might be sick? My name is Sarah, and I have questions about women's heart health. All right, well, joining me right now is Chelsea Gongang. She is an MD in cardiology with Wake Med. Welcome.
Thank you for having me.
So we're talking about hearts today. Let's just jump into heart attacks. A lot of people, when they think of heart health, they think of heart attacks. How does a heart attack change, or how does it present in a woman versus a man?
So main thing about it is that when we first did all the research studies, pretty much 40, 50 years ago when it came about heart attacks, they were mainly done in men.
Oh, really?
Yeah.
Oh, I'm so surprised.
So we have these things called typical and atypical symptoms.
Okay.
Typical symptoms are really what's seen in men.
Okay.
And then atypical symptoms are what we think about seen in women.
Oh, isn't that just, Yeah.
So
Okay.
it's not necessarily the fact that it's actually atypical. It's just the fact that that's who was studied. Okay. So we can still see typical symptoms, quote unquote, with women as well. And so when we think about main symptoms for a heart attack, of course, anything like clenching your chest, feeling like you're having chest tightness, squeezing sensation. A lot of times people will feel pressure. They'll say something like an elephant sitting on their chest. Oh. They might not actually feel pain. They might just feel like a lot of pressure on their chest. Like they can't take a good deep breath. For women, a lot of times, they might actually end up getting things like nausea. So nausea, just feeling overall just bad. Like they're not able to do the things that they would normally do that day. They might have some sweating, fatigue, things like that we see a lot more common in women than we do in men.
Well, so saying that makes me think I could have gone to the doctor numerous times for a heart attack in my life, especially around what I like to call special lady time, because I will sometimes break out into a sweat. I will sometimes get nauseous. I've certainly gotten lightheaded around that time. So, how are you supposed to tell? Like, do you get a lot of people going in for these symptoms and it not actually being a heart attack?
Oh, yeah, absolutely. Especially during, like you were talking about, perimenopausal time, where you have vasomotor symptoms, which is basically what you were saying as to having night sweats or palpatations, heart racing, all of a sudden feeling fatigue and sweaty, things like that can actually be around the time that people are starting to have menopause. They can actually feel like they're, having something that is going on with their heart because their heart rate can go higher. They can have higher blood pressure during that time as well when they're actually having a hot flash. And so it can be very much so symptoms that they can feel like something might be going on with their heart too. And so usually the difference though is that usually hot flashes or vasomotor symptoms that happen when it comes to perimenopausal time, they're usually lasting about 5 to 10 minutes. and then you get some type of relief. And usually it's relief without any other intervention besides maybe getting a cold pack, sticking your head in the freezer, something like that, right?
Yeah, everyone's
Yes.
seen their mom do that.
Absolutely, absolutely. But actually, with a heart attack, you're not getting relief. So you need something that is going to relieve that burden of what we call ischemia or low blood flow into the heart. And that means that you have to either get aspirin, you're going to have to get nitroglycerin, something that is going to open up that artery better. And just drinking some water, just putting your head in the freezer, just laying down is not going to relieve it.
A pack of cold peas isn't going to do anything for you.
It's not going to do it. It's not going to do it.
Well, speaking of perimenopause and hearts, is there any correlation between hormones and heart health and heart attacks?
Absolutely. So one of the things that we think about when we talk about risk stratification when it comes to men and women is that you'll see in a lot of guidelines, they talk about family history of heart disease, and we'll talk about men and their age is usually about 10 years earlier than women. And because of that, we think about the risk of patients that have heart attacks. And so we'll talk about men being around their 40s, 50s for like early heart disease. And then for women around 50s, 60s because of the fact of estrogen. Okay, so estrogen and progesterone play a huge role in protective roles when it comes to our coronary atherosclerotic formation.
Okay, you gotta explain what that is.
Absolutely, absolutely.
God, that's a big Scrabble word right there.
So atherosclerosis is basically the plaque that forms in coronary arteries. Plaque is basically cholesterol and a couple of other portions of the blood cells that end up forming the lining on the actual arteries. And when it forms that lining on the arteries, it keeps on building and building. It makes a little mountain, and then that mountain can rupture. And that's what causes a heart attack.
Yikes.
Yeah. And so we want to make sure that mountain stays very, very low or not at all.
Right.
And that's basically keeping your arteries clean.
How do you do that? I mean, you don't have like a snake like you use for your plumbing.
Yeah. So that's what we do. We do roto-rootering.
Do you really? Do you have like a snake that goes in?
Oh, yeah. Yeah, absolutely. Okay. Absolutely. We have lasers and all kinds of things to be able to go through the arteries and kind of declog them as well. But don't let that be people's backup.
Oh yeah, Lord, no! I don't want you to do that.
We don't
that
want
sounds
that.
horrible.
We want to do prevention. That's what we're here for. We're going to do prevention. So main things that are going to be helpful for prevention is going to be things like high fiber foods. So things that are going to be high in fiber. So of course, leafy green vegetables, fruits, things like that. One thing I want to tell you about it, people don't realize is that a lot of times frozen vegetables and frozen fruits are actually better than fresh. And so people don't really think that way because we always think, oh, everything has to be completely fresh.
Right.
Because of the fact that fresh foods, if you get them from like the grocery store, not if you go to the farmer's market, which we have a great farmer's market here, or you grow them on your own. But basically when they need to be packaged and shipped, they're usually cut before they're ripe. And so you're not getting all those nutrients. So actually, when you get frozen vegetables and fruits, they're actually cut at peak ripeness. And then they're flash frozen and packaged. And so when you're getting them and you're cooking them, you actually, if you cook that compared to cooking a fresh one, you actually can get 4 times more nutrients.
Wow.
Yeah. So that's one of the things that's helpful for them.
Well, I have a question about the fact that you said fiber is going to help you keep your arteries clean because, I mean, I can see fiber keeping your digestive system clean because it like scrubs it out. How is that keeping your arteries clean? Because
it helps you get rid of the bad cholesterol. So just how you're saying it scrubs you out because you're going to definitely go to the bathroom.
That's right. You know, we've all had collard greens.
Yes. So eating those collard greens, not with the pork in them and things like that. But eating definitely leafy green vegetables and high fiber diet with oatmeal, oats, things like that. Well, what they do is it ends up helping you get rid of the LDL cholesterol and the VLDL cholesterol. These are the bad cholesterols, right? Okay. This is what I call the low down dirty dog. LDL, low down dirty.
I got it. I like it.
They're the depositors. They're the ones that deposit cholesterol on your arteries.
Okay.
You do not want those numbers to be elevated. You want them to be as low as possible. And so eating high fiber foods help you get rid of those through your poop.
So they're
binders.
So they bind to it. That's what my question was. Interesting. Yep. Okay, cool. So what other ways can we keep our arteries clean?
So other ways that can keep your arteries clean is basically one thing I would say is you can't outrun your genetics.
And
Yeah.
that's not fair.
It's
I
not
mean, you
fair.
meet people who are athletes and like do
Oh,
all the
yeah.
things. I'm assuming exercise. Every doctor we come in here is like, you got to exercise. Like
Yeah.
every single doctor.
Yeah. Only problem is that, I have plenty of, marathon runners. I have plenty of like people that exercise regularly and they're still on meds.
Yeah.
And it's because people in their family previous, they died early. And they are now older and able to have family and grandchildren and children and things like that, and see them later on in life where their parents and grandparents were not able to because their genetics unfortunately did not allow that. And so now we have modern medicine to kind of fight the genetic battle.
And so how would you find out if your genetics are bad? Just because your cholesterol is bad? Like no matter the fact that you eat oatmeal every day and you go for a run every day, you still need to go have a physical, have this type of stuff checked.
Absolutely. So if you know your family history, which I know unfortunately some people do not know their family history, but if you do happen to be fortunate enough to know your family history, that's like aunts, uncles, grandparents, your mother and father, brothers and sisters, if they've had premature coronary disease, so say if they've had any type of coronary or any type of event, stroke, anything like that, before the age of 50, I would say men or women, then you really want to be able to look into if you have any of those issues yourself, like if you have any risk factors for those issues. So that's cholesterol, making sure your blood pressure is well controlled, making sure your sugar is well controlled for diabetes, things like that you want to be able to take in consideration, because I have patients that literally work out, eat healthy, they do everything I ask them for.
Right.
And they're still on 3 meds for blood pressure.
It's just genetics, man.
Genetics but their family members are on dialysis.
Oof. So how does it lead to dialysis? Dialysis is whenever you have to, they basically replace your kidneys, correct? So like you have to get your urine filtered through a machine. Isn't that what that is?
Absolutely. Absolutely.
So how does your heart associate with that?
So dialysis has a huge play when it comes to heart health, because a lot of times what we have accelerated atherosclerosis, so accelerated plaque on the arteries when patients are on dialysis. So dialysis can be a huge burden onto heart health, and that's the reason why prevention is so key. Not to say that dialysis is like a death sentence, because we have plenty of patients that are on dialysis for a long period of time before they if it's actually a destination therapy where they're on it lifelong, or if it's a bridge to actual transplant. We have plenty of patients that do well on dialysis, but we still need to be able to make sure that we try to prevent this, because it can actually accelerate atherosclerosis and cause heart disease.
Okay, so it's not the heart disease causing the dialysis, it's the dialysis that could cause heart disease.
Absolutely.
Gotcha. Okay.
And also the other thing is that high blood pressure, which is a factor in heart disease, can cause dialysis because it's almost like you want your arteries to feel the pressure of like if you have a water hose. So if you're watering your lawn, or you just actually open on the water hose and the water is falling out, well, that's how we want our blood pressure to be. But you don't want your blood pressure to be like opening a fire hydrant.
No.
Because if you're opening a fire hydrant, imagine that same pressure of water hitting up against your kidneys. Okay.
Oh.
So that is blasting all of your little tissue of your kidneys out and completely open. So that's the difference between, you want it to be gentle amount of like water that's coming out, and you want it to be gentle blood pressure. You don't want it to be the other way around.
I'm gonna take this down to an elementary level. So your kidneys are filtering your blood, and that's what's creating the urine.
Yes.
Yeah, I didn't really know that until this moment.
No, you got it.
I didn't go to medical school.
No, you're fine.
So I was reading I think it was on the American Heart Association's website, and back pain and jaw pain are really common when someone's having a heart attack. Why is that?
So a lot of times this is about like in utero, basically when you're getting developed, your body is flipping around in multiple ways to get your organs in the correct places. And those nerves are flipping around in different places as well. So you can have something called referred pain. So the nerves that all started off maybe in your gut that have moved to your back, but they are near where your heart is, those same nerves, as they're so close in origin to each other, you can feel them there. So that is one of the reasons why we talk about people that have like appendicitis might have where appendix is down here.
Yeah.
You might feel the pain in your upper abdomen.
So that your appendix is by your right hip and you can feel it in between your ribs.
Absolutely. Or you might have a gallbladder issue and you feel it in your heart.
Oh, interesting. So how are you ever supposed to know what's wrong with you?
Yeah, it's very challenging. I think basically you just have to be able to just get checked out.
Yeah.
You have to just go get checked out. Just
Yeah.
don't ignore it. Don't drink water. Don't drink apple cider vinegar. Go get checked out by someone just to make sure. But that is definitely very common. Jaw pain. I've had patients that have gotten teeth removed thinking that it was their tooth and it was actually a heart attack. Yeah.
Wow.
They were having, where it wasn't a heart attack at that moment, it was unstable angina, meaning that they were having chest pain at rest. Angina means chest pain.
I see. Okay.
And that's what they were happening.
Wow. All right. I want to move to some rapid fire things.
Sure.
Okay. So I've heard from various people in my life, and I won't name names given the nature of a couple of these questions, that these people have ended up in the ER thinking they were going to have a heart attack. So I want you to just speak on what comes to mind. Acid reflux and heartburn, and ending up in the ER thinking you're having a heart attack.
Oh, absolutely. It happens all the time.
Does it really?
Yeah. Oh, all the time. Absolutely. So I would say acid reflux can make you feel like you're dying. It really can.
I mean, I have it sometimes.
Hopefully you will never have the type of acid reflux that makes you feel this bad. But I've definitely seen some terrible acid reflux before.
Oh.
And so what it does is it ends up causing it. So the esophagus is right near the heart.
Right.
And so if the esophagus is having any spasms or you're having acid that's coming into the esophagus where it's not supposed to be, then you're going to have pain in your center of your chest. And if everybody tells you that pain in the center of your chest is the heart, you're going to come to the emergency room.
That makes sense.
And so one of the ways to kind of be able to decipher between some of this is that you can take some antacids at home. So you take some Tums, you take Rolaids or some Pepcid, Nexium, something like that at home. If it's not going away, those you usually act pretty quickly.
Yeah.
So if it's not going away after about 15 minutes or so and it's getting worse, or acid reflux does not change with exertion. Okay, so if I start walking up some stairs and I have acid reflux, my acid reflux is going to be the same acid reflux.
Right.
If I walk upstairs and I have angina, which is chest pain from the heart, it's going to get worse.
I see.
Because it requires me to make more blood to the heart. And if I can't get blood to the heart because of a blockage, it's going to hurt more.
Gotcha. Okay. When I was pregnant, I was really worried because I thought I was having heart palpitations. And honestly, they've continued to happen now. I'll feel like a fluttering in my chest and I'll check my pulse and it's just fine. What's going on there?
Oh, absolutely. So heart palpitations are quite common in pregnancy. Also, they're quite common in the general population. So heart palpitations are usually when you have an extra beat from the top chamber of your heart, which are the atrium, or the bottom chambers of your heart, which are the ventricles. These are called premature ventricular or premature atrial contractions. They're quite common. It's one of the most common things that I see in clinic on a regular basis. They're very benign.
Oh, good.
In most cases, they're completely normal. Most people, I would say probably 99% of the time, they're completely benign. There are things that can change your palpitation frequency. So caffeine is one thing that can really increase
off all my questions here.
Yeah, that can it will really increase it. So palpitations can definitely happen more with caffeine, any type of energy drinks, things like that. Dehydration is another one. So if you're not staying hydrated, you need about 64 ounces of water a day to make sure that you're staying adequately hydrated. But dehydration will definitely do it. Also around menstrual cycles. So perimenopausal as well as around your menstrual cycle, you can have increased amounts of palpitations.
Well, okay, I need to back up. Why? Okay, first of all, 64 ounces, is that for every single body for a 10-foot tall person versus a 5'4" person? You still need 64 ounces.
You'll pee out the rest of it.
Okay.
Now, only time that changes is if a person has heart failure or kidney disease.
Okay.
Because they might not be able to filter out that much water, and also they might retain too much of that water if they have heart failure.
Okay.
And so it might change, and we'll have to talk to your doctor about how much water you should have. But the general person should do about 64 ounces, which is about 4 bottles of like 16-ounce bottles.
Okay. And how does that make your heart healthier?
Oh, so the way that makes our heart healthy is basically your total body, because your body is about 80-90% water.
Which is crazy to think about.
Yeah, absolutely. And so if you're not having enough water, then you're going to put yourself in a dehydration state. And a dehydration state means that your cells are not working appropriately. The rest of your body is not able to function appropriately. And so that's the reason why it's so important to make sure that you're hydrated.
Interesting. Okay. Well, you hit on the caffeine and you hit on skipping a heartbeat or adding a heartbeat, because that was my next question. What about cold medication?
So cold medications, a lot of times I would say for making sure that a person talks to their doctor or their primary provider about whether they should take certain cold medications, especially ones with phenylephrine, so decongestants.
Yeah, I've had that happen to me.
Absolutely, because those can actually cause you to have more palpitations and also increasing your blood pressure. So a lot of times what we'll use is chlorocidin D or chlorocidin HBP, which is basically a type of medication that can help out with congestion and symptoms like that, especially as we're going through the cold season, without increasing your blood pressure.
Seems like that might be dangerous to have something that affects your heart. Did you ever recommend those type of decongestions? Or
at times. So like people that are completely healthy, have no hypertension history, things like that, then yes, usually they can take them. The pharmacists try to do pretty well with them because they are behind the counter. So you do have to use a actual ID to get those types of medications that they have a decongestant in them, because some people do other things with them.
Terrible, nefarious things.
Yes. So that is something that they try to make sure that people are careful about.
Gotcha. All right. Well, I only have one more question, and this is probably my most commonly asked question when I told my friends I was doing this, and that is gummies. Marijuana gummies, Delta 8 gummies. Because in North Carolina, marijuana is not legal, and so they have these strands called Delta 8 and Delta 9. And I've had a few people come up to me and say, I tried the Delta 8 gummy, and it made my heart go crazy. Have you heard anything about this?
Yes. So the thing about it is that we don't have a lot of evidence about heart health and marijuana use. We definitely do have some research, but because it's not technically it is not FDA approved, and it's not necessarily legalized across the board.
Right.
It's only certain places that can do randomized clinical trials.
Right.
And so when you don't have randomized clinical trials, you can't get what we call like guideline-based therapy or studies or guidelines for what we're going to do when it comes to medicine.
So it's the Wild West out there.
It really is. Okay. It really is. And then the thing about it is a lot of times we don't know who's making the products. And so it's like how am I going to say that your process and procedure of making this is going to be safe for my patients? Whereas like when we have the FDA, whether we have issues with them or not, but at least we can say that, I know if this has been passed by the FDA, that they have gone through these steps to make sure it will stay for my patients to be able to take.
Gotcha.
For me to give advice on marijuana gummies is really difficult because there's no process and procedure when it comes to that. We are able to sometimes give advice on like I tell my patients about magnesium all the time, right? And magnesium is not technically FDA approved.
Okay.
But it is a supplement that I have seen a lot of benefit with, and it's been on the market for so long that we can kind of basically kind of figure out from the generalized situation that is actually beneficial for patients.
In what way?
So we love magnesium when it comes to sleep. Really does help out with sleep, helps out with blood pressure, helps out with palpitations, with anxiety.
Wow,
so,
a lot of stuff.
Yeah, a lot of stuff. So really has been really, really helpful. I like to use a formulation glycinate.
Okay.
So there's 3 different formulations on the market for magnesium. A lot of times you'll see is oxidate, citrate, and then glycinate.
It's not milk of magnesia. Don't do that.
Yeah, milk of magnesia. You're just going to go to the bathroom.
That's a laxative.
That's about it.
Hey, you heard it here first. Don't take milk of magnesia. Take the supplements.
Yeah. It does help out with like if you have acne, you can put it on there and it'll dry it up.
See, magnesium's a cure-all.
It's amazing. It's amazing.
So if you had any kind of, I lied to you about that being my last question. If you had any advice as far as like just a general advice for people to keep their heart healthy and to keep them out of your office, what would you say?
I would say eat well.
Eat fiber.
Eat lots of fruits and vegetables. Make sure you watch out on your red meat, fried food intake. So those are the big things that you want to hold off on. Olive oil is the best thing ever.
I go through gallons of it.
Yeah, olive oil is the best thing ever. If you can keep away from the vegetable oils and other types of oils, canola oil, things like that, you want to stick with olive oil, avocado oil, or grapeseed oil.
Gotcha.
Those are the types of oils I would recommend. Then activity. Activity is very, very important. If you can get in activity at least around 20 minutes, 5 times a week. If I am a person, I am a realist, okay? I think that if you're able to do something, it's better than nothing.
Move your body.
If you move, like find something you enjoy, whether it's dancing, Zumba, if you like working out, if you like doing weights, whatever you like to do. If you find something you enjoy doing, do it. And then if you don't enjoy anything, just do 5 minutes.
Yeah, I have a friend of mine who hates exercising or moving in general, and that's good advice for her.
Yeah, just do 5 minutes. You can do 5 minutes during a commercial.
Just get up and hate every second of those 5 minutes.
Every second, but walk in place, do a jumping jack, whatever you need to do.
Okay.
But it's better than what you did the day before.
That's it. Okay. All right. And sleep as well, or no?
Sleep is amazingly needed for me right now, but it's needed for everyone.
Yeah.
So if you are able to do 6 to 8 hours of sleep, everyone says 8 hours. I know it's very hard for most people to get a full 8 hours, but that is what for guideline proven to be able to be restorative and being able to make sure that we're doing well with when it comes to our blood pressure, just overall health in general.
Gotcha. All right. Well, thank you so much. This was super informative.
Oh, well, I am absolutely pleased to be here. Thank you so much for inviting me.
Yet again, you need to exercise. And how interesting is it that eating fiber not only cleans out your digestive system, but it actually cleans your heart as well? The entire body is connected, and it is so fascinating. Sarah Has Questions is a production of Capital Broadcasting Company. My guest today was Dr. Chelsea Gongang with WakeMed Cardiology. To find out more about her or any of the other providers from WakeMed, go to wakemed.org. If you have thoughts about any episode or questions you want me to ask in a future episode or ideas for an episode at all, send me a message in the link. You'll find it in the show notes. Thanks for listening.